Good afternoon, America. Welcome to Channel 21. Breaking news. There is new research being created on a mobile application that hopes to treat major depressive disorder known as depression. Major depressive disorder affects three parts of the brain: the hippocampus, prefrontal cortex, and the amygdala. This damage in the brain can result in disturbances in sleep and activity patterns, memory loss, along with other complications due to irregular amounts of hormones and other chemicals. Antidepressants tend to restore brain function. The effectiveness and safety of various antidepressants have been studied and reviewed for being given to children. Some antidepressants are ineffective in children and have limited effectiveness in adolescents with safety concerns for both. Concerns about antidepressants have spiked due to possible outcomes of suicide and limited effectiveness.
Dr. Scott, are there psychological side effects to long-term antidepressant use, like becoming indifferent or apathetic because you can't feel your feelings as much?
Yes, there really are. And in fact, it's the psychological effects that have led to more knowledge about the drug studies that led to the approval of these drugs than anything else. We have what's called the Freedom of Information Act in America.
All right.
As a result of that Freedom of Information Act, whenever we have a lawsuit, we can go and get information that the drug companies do not want us to see. And so as a result of some killings where we had people taking these drugs who had no history of violence, all of a sudden start killing people that they didn't even know, we've had some just real tragedies. A number of these have happened. And it's led to lawsuits that have allowed us to look at the drug studies. It's revealed that, boy, there's a lot going on there that we didn't know about. Absolutely, these drugs can cause suicidal thoughts, for example. The drug companies knew this early on. They knew the agitation that is common with these drugs. They knew that before they were ever approved the first time.
Instead of antidepressants, doctors have turned to pleasant activities such as photography, going to the museum, reading, and behavioral treatments that allow patients to learn techniques to monitor their mood and daily activities. Yogic breathing is a method to balance their autonomic nervous system and influence psychological and stress-related disorders. Yogic techniques increase well-being, mood, mental focus, attention, and stress tolerance. The research details for this new application being created to treat depression entails participants who consist of female and male freshman, sophomore, junior, and senior undergraduate students from Hampton University that are suffering from major depressive disorder. Participants are recruited through the on-campus peer counseling center. This new application will have online monitoring, daily notification to do pleasant activities, and a new feature, yogic breathing and meditation techniques. While this new mobile application is being created, try Pacifica. This is a well-known mobile application created to supply those suffering from depression with daily tools to reduce stress and anxiety, along with a way to contact clinicians and access community support. Over 1.9 million people use Pacifica to manage their health. Stay updated on the research, folks, through our news channel. Channel 21 News is always here for you. Stay updated on the research, folks, through Channel News. Stay updated on the new research through Channel News, folks. Channel News is always here for you. Good afternoon, America. This is Channel 21. Breaking news. There is new